Welcome to Leaning into Public Health Values, what Bill Foege brought to public health, a conversation with Dr. Judy Monroe. My name is Merlene Tucker, and I'll be running this Dialogue for Health web forum alongside my colleague Jeff Bornstein. This web forum is sponsored by PHI Center for Health, Leadership, and Impact and produced by Dialogue for Health. Now it is my pleasure to introduce the moderator of today's event, Dr. Carmen Rita Nevares. Carmen is a senior advisor at PHI Center for Health, Leadership, and Impact, founder of Dialogue for Health, and senior vice president emeritus of External Relations and Preventive Medicine at the Public Health Institute. Welcome, Carmen.
Thank you, Merlene, and welcome everybody. Thank you for joining us. When Dr. William Foege passed earlier this year, many of us felt that a great public health hero was taken from us too soon, at a time when great leaders in public health are most needed. If there's a single accomplishment for which Dr. Foege will be remembered, it is the eradication of smallpox, which killed 300 million people in the 20th century alone. But there are many, many, many other lessons that we can learn from the career of this brilliant and very courageous person. Today's conversation is going to lean into some of those lessons, and will give us a moment to think about how to integrate his wisdom into our own work. I asked Judy Monroe to join us today because she's an artful storyteller and can share some of these stories and help us to reflect on how to do our work in the spirit of those who hate to lose. I really am delighted to invite Dr. Judy Monroe into today's conversation. She currently serves as the president and CEO of the CDC Foundation and has dedicated her career to protecting people and saving lives. She joined the CDC Foundation in February 2016 after serving as the deputy director of the U.S. Centers for Disease Control and Prevention and director of CDC's Office of State, Tribal, Local, and Territorial Support. Before her tenure at CDC, Dr. Monroe was appointed the Indiana State Health Commissioner by Governor Mitch Daniels. Earlier in her career, she directed a residency program at St. Vincent Hospital in Indianapolis after starting her medical career as a practicing physician in the mountains of rural Tennessee. The CDC Foundation, under Dr. Monroe's leadership, has responded to numerous emergencies, including the COVID-19 epidemic, the Zika epidemic, Ebola, and several hurricanes, and supported departments and community organizations across the nation to make progress on the critical health challenges that we face today. Welcome, Judy.
Thank you. Wonderful to join you.
Great. So glad you could. I wanted to just ask a few questions and see if we couldn't get into some kind of a discussion of some of the best lessons that we can learn from this really great thinker and doer in public health. But first, why don't you start by telling me about your professional relationship with Dr. Foege and how his approach to public health helped you to shape your leadership in the many roles that you've held.
Yeah, so my starting point with Dr. Foege, who's just a giant in public health, for all of y'all that know of Dr. Foege. So it was, you already mentioned, I became state health officer in Indiana in March of 2005. So I'm transitioning in my career from practicing medicine, teaching in a residency program into public health. A month later, in April of 2005, across my desk, because you become a new health officer and you start getting all these new emails and you're on new chains. And lo and behold, I see this announcement about a Dr. Bill Foege, who's given the Dr. Thomas Francis Jr. lecture at the University of Michigan in celebration of the 50th anniversary of the Salk polio vaccine. And it turns out that Jonas Salk was the mentee of Dr. Thomas Francis Jr. that were the lecturer. So I was captivated because my mother had polio, and polio was really a driver for me wanting to go into medicine and public health. And so I started reading this, and I didn't know who Dr. Foege was. And I start reading this lecture, and I was mesmerized because talk about storytelling. He could weave a story, but he was a master at bringing history into the stories and the historical figures. So I'm reading this story about the Salk polio vaccine, and particularly the part about the public demand. I mean, many of you, if you know the history of polio, the vaccine became available. The government didn't have a plan. There was no plan to distribute or to purchase. And the public backlash was so great that President Eisenhower, and at that time, Mrs. Hobby, who was the secretary at that time, I think it was Health, Education, and Welfare, they backed down and they said, okay, we're going to have a government plan and we're going to make this available to everyone. That was because of the fear of polio that had instilled so much fear in parents and across communities. So I was just like so taken by this that I started studying who he was. I was like, who is this Bill Foege? And of course, I ran across his some of his speeches and his writings, and of course his wisdom. And so that was my starting point to begin to look to him as a mentor. He didn't know me at that time, but he became a mentor of mine in that fashion. And then I was lucky enough to meet him. I came to CDC in 2010. And not too long after I'd arrived, Dr. Frieden, who was CDC director, invited Bill Foege to come speak to the senior leaders. And so we had this incredible dialogue. I thought, I was just pinching myself that I had this opportunity to meet Bill Foege in person and to have a dialogue with him. And he imparted his wisdom and his leadership style. And, he reminded us of what's important. I distinctly remember that. He talked about the importance of family and our taking care of ourselves, but also how fast time goes, and how if our aim is to make a lot of money in life, we're kind of missing the purpose, the real purpose in life. So there were all these this wisdom and style about him that was just amazing. The other thing about Dr. Foege is his humor. He used humor in ways that I don't know that I've ever seen anyone. He was self-deprecating. He would laugh about the situations he'd been in. And then in let's see, it was 2016, I came over to the CDC Foundation as president CEO. And the first phone call I made was to Bill Foege, because by this time I'd gotten to know him in my role at CDC. And I called Dr. Foege. He graciously took my call, and I asked him, what should I do? What would he do if he were coming into the role of the CEO of the CDC Foundation? He had actually been on the founding board of the CDC Foundation. And the one thing about Dr. Foege too, just so everybody's aware, he obviously is known for the eradication of smallpox, but my gosh, this guy, he was the first director at the Carter Center. He played a big role in the eradication of guinea worm, or we're almost there. We're just short of that. He influenced Bill Gates and the Gates Foundation and all the work that they've done. He started the Task Force for Global Health. I mean, it just goes on and on. So he is such a legend. And so I also, in my 10 years now, before his passing, had a lot of interaction with him. And we actually were able to support him in some of his writings at the end. He's written several books. So his last book, we were able to help with some staffing for that. I did a podcast. I had an opportunity to have him on the Contagious Conversation podcast, he and Mark Rosenberg, and that was a wonderful conversation that we had. I wrote some op-eds with him, and he just, I got to know his family. So actually, I was one of the speakers at a memorial service for him at the task force. Very honored to be able to speak on behalf of the foundation and public health on what it meant. So he influenced my leadership from the start of my career in public health. And I would turn to his writings when I had questions or when I was up against struggles, because he was such a North Star, and kept principles. He was so principle centered. Amazing.
Yeah, one of the things that I realized in all of the videos that I was reviewing in preparation for today was what a great storyteller he was, and how he would wrap his stories around a principle. Yep. In a really nice way. And, a few years ago, you made a great presentation to our leadership teams that we've always called Dr. Foege's 10 Commandments of Public Health. And I wanted to know if you would talk about those 10 commandments now and share some of your stories about why these commandments matter now.
Yeah, so and I what's interesting about Dr. Faggy, he was so prolific and he gave so many talks that I it's easy to go through 10 commandments or 10 rules for public health. I don't know if it'll be exactly the same ones as I talked about because he's so prolific, but some that really stand out for me. Number one, he uh always shared that we should avoid certainty. So if you're in public health, avoid certainty. Never be so assured that you give that you think you know the answer. You've got to remain open to new evidence and new perspectives. And I'll give a couple of examples of that. It's not just for yourself, but others too. I was a new health officer in Indiana, and I remember that folks were coming to me saying, we have done such great work increasing the screening for osteoporosis in the state of Indiana. I was like, oh my gosh, tell me more. And I learned that they were using the heel ultrasound and they were going to college campuses to screen for osteoporosis. And they had all these legislators excited about the numbers. And I had to be the bearer of bad news. And I said, that's not evidence-based. And actually, the DEXA scan is the gold standard, and you're going to the wrong population. And then they were getting false positives, and that was one of my early times uh, that I had to be the bearer of the science and come up against the politics. Because let me tell you, the legislators were not happy when I stopped the program, when I stopped that part. But if you think about COVID, let's take that lesson in COVID, right? Early on, there was evolving guidance, and remember, everybody was like, let's clean the surfaces. And they were treating it like it was a fomite transmission. And then as new data came, had to back off of that and say, you know what? There's ventilation that we need to think about, and there's other types of, high quality masks, and there was a lot of assurance from some public health to folks that had questions, and that worked against us in public health. So that avoiding certainty and keeping that open, I think, is a huge lesson on so many fronts. Another one that I think, in the audience, especially the young folks, but I think we all need mentors. He always told everybody to find mentors when you're in public health or in any career, I think, but seek out those experienced leaders who can guide you and share wisdom. The EIS program, the Epidemic Intelligence Service program at CDC, has always applied that because when new disease detectives come in, they get assigned to someone more seasoned as their mentor. So you can have formal mentors and informal mentors. And so I just described Bill Foege became my mentor the first speech that I read because I knew this was someone I wanted to learn from. So I think we all should have our mentors that and cast your net wide in that advice. Have those close mentors. Sometimes it's a specific question that you need expertise. Sometimes, my mentors, Tom Frieden was a mentor. Mary Pittman from Public Health Institute, Carmen, I've learned so much from you. I mean, we learn across our careers, and we never want to stop that, right? So that's a huge lesson. A third lesson, and I love this one because I think it'll speak to so many of us. He told us that we have to continue to learn, and that continuous learning is just so essential. Let's look at during COVID, the whole field was learning new surveillance when wastewater surveillance came along. Like we before it would all be, what are the cases coming out of the clinics, right? And now we have this whole new tool, but we had to scale. You had to learn how to use that. We've got here at the CDC Foundation, we're activated now for the Ebola in the DRC and Uganda. We activated in 2014-15, but this is a different strain. We're learning, right? This is not the same at all. And it's harder to diagnose, we're learning, right? Because the symptoms are maybe different than what other strains of Ebola have been. And then, of course, goodness gracious, AI. We could go on and on about the need to continually learn and how we frame that. And I think Dr. Foege was one that just modeled that so well as a student. Another lesson that he gave was always to think long term, like think beyond. And one of the things he said is that leadership is actually measured by what happens after you leave more so than what you're doing in the moment. So think about that for those that are leaders in the audience and thinking about your own legacies and so forth. And that to me speaks to systems change. And Carmen, we've talked a lot about systems change and ecosystems. If we've got to be focusing on sustainable solutions and impacts, but we can do that in many different ways. At the CDC Foundation during Ebola 2014-15, we were able to mobilize a lot of resources, a lot of funding. In turn, we were able to purchase vehicles, help establish laboratory capacity, help establish emergency operations centers and that type of thing. And we left all that behind. And I went back 5 years after that response to West Africa. Folks were so proud of using the resources that we'd left behind. So it can be played out in a lot of different ways. Certainly, Dr. Foege left a lot of institutions that he helped establish. But even in, as we think about how we approach diabetes, that public health has to think about social determinants of health, planned community, if you really want to get to the prevention. So I think that long-term thinking is really important. Another lesson he talked a lot about was improving on history, the history that has been laid before us and those that came before us. He gave a wonderful, along with that one, he also gave a wonderful commencement speech at Emory University where he talks about becoming better ancestors. I mean, he's got a whole project on becoming better ancestors, but also writing your own obituary. And so he teaches us that we're writing our own obituaries with each day that we live. So that's a powerful message. But on the improving on history, we want to build on those past successes. So I'll give the example of the global response to mpox. It hasn't been all that long ago that we had the big outbreak of mpox. And what they did is they used the ring vaccine technique to stop that. Instead of trying to vaccinate everybody with mpox, which would have been a huge endeavor, they improved upon Dr. Foege's. Actually, he's historically came up with the ring vaccination methodology to eradicate smallpox. And he got that. I love this part of the story. He got that because as a young man growing up in the Northwest, he grew up in Colville, Washington. He was helped with the forest fires. And with forest fires, they'll do a ring, you burn out a section, and therefore the fire gets stopped because it's burned out and you don't have, so it's kind of this ring, burning the ring to stop that. So in this case, what you do is you track down the contacts of those that have the disease and then do the ring. You're vaccinating all of those people to kind of form this firewall or this ring around it to stop the spread. A sixth lesson, and this one he's written books about. He wrote, a couple of his books are really focused on the power of coalitions. It's sharing knowledge and working across sectors. And he also was involved with this. So a nice example is Gavi and the Vaccine Alliance, and that is a coalition of the WHO, UNICEF, World Bank, philanthropy, vaccine manufacturers. I mean, you see the private sector, you bring everybody together with a common goal, and the common goal was routine immunizations across the world, and particularly to children in our in countries that have so little, and highly, highly effective there. He also one of his lessons, and again, there are many lessons in there. He's got, I'd be remiss if I didn't talk about his 9 lessons for becoming better ancestors and his 9 lessons that come from Ebola. That folks should look that up, and maybe we talk more about those 9 lessons later. But he did talk about individuals matter. So the coalitions matter, the individuals matter. And in that case, an example I would give, and this really gets to the root of culture. He gave, if you look at, and you've done a lot with opioids, if we look at harm reduction, right, and culturally tailored harm reduction, instead of looking at overdose spikes as abstract statistics, we look at that at local public health looks at that at a very person-centered approach where you meet the individual where they are with whether it's naloxone or it's your clean needles or fentanyl test strips, et cetera. So it's that part. Carmen, you and I just talked about this one. The eighth lesson I would give is Dr. Foege was a systems thinker, and he looked at the whole. And he said, we've got to look at the whole picture. And so One Health is a nice example of that one. You may have the researcher who's studying the virus in bats, in a particular, population of bats. But if that researcher is not thinking about the deforestation that's taking place, the impacts that climate change has had, the impacts of global livestock on then the ability of those bats to be in contact with humans, you lose the whole picture. You lose the big picture. And so and no matter what work that we may be very specific, rising up and looking at that whole. Um, and then a ninth lesson is Dr. Foege was very, very specific, letting us, he loved science and he believed in science, but we have to recognize the limitations of science. And I think vaccines, I think this is so timely for what we're doing right now, and with the vaccine hesitancy and the drop in childhood vaccines, adult vaccines. We can have the science and you can have the best vaccines and the most effective, but that doesn't get those shots in arms, right? And so that art of communication, that art of understanding that science does have its limits, and there's a major piece here. The thing that always struck me with Dr. Foege is all of his leadership principles really are about humanity at the heart of things, and so we can't forget that. And then a 10th lesson that I'll share that I like. So yeah, I've kind of put this list together, and again, I could probably have a list of 20 or 30 lessons from him. But one of the things that always resonated is he said he used to teach students, and he said this in his Emory commencement speech, is don't have a life plan, have a life philosophy. And what he was getting at, and my own career is this: if I'd had a life plan, I never would have ended up in public health. I never would have ended up at the foundation, because who would even have known those opportunities were there? I had no idea. But he says that if you've got a life philosophy, that you want to help people, that you want to have purpose in your life, you want to be science driven, but have humanity. If you want to embrace his principles and really apply those, then you have that philosophy that grounds you. But to have a life plan might actually limit you from what possibilities may come. And then the other is the needs. He used to say that home is not where you're from, home is where you're needed, is one of his. I think that comes from Cutting Stone, the book. That's the other thing. If we all lean in and go to where we're needed in the moment, that may take you on an adventure and a rich career in life that you never would have imagined otherwise. So, no, not a life plan, but a life philosophy. But I'll end there. Like I say, I could go on. and we have these 9 lessons from smallpox.
Well, and I may ask you to go into the 9 lessons from smallpox, because what time, better than now to really think a little bit about the diseases we believe that we've conquered, that maybe we still need to do some work on. So I really am going to encourage the audience, your thoughts, your reflections, if there's one of those lessons that really stood out for you, and that relates to something in your experience, I'm happy to read that and share that with the rest of the audience. We want to figure out how to get you engaged and involved in this conversation. One of the things that I was impressed, as you were going through that list, there was the one about the power of coalitions and working across sectors, and sort of brought to mind a story about him that he told, where he talks about river blindness and the use of drugs for river blindness, and then sort of blends off into a discussion about the heartworm medicine for dogs. And
Yes.
and as you're thinking about this, you think, well, river blindness and dogs, why does that come out of the same place? But it kind of does. And the part of the story that I thought was really interesting was when he was talking about a condition where early in the disease, people were itching and scratching themselves constantly. And that he had figured out a way to get the drug company interested, or the population interested, because if you went and got vaccinated, it would manage your problem with the itching. And you might not be thinking about the blindness 20 years down the road, but the itching was the piece that really spoke to people in their moment of need. And then with respect to the pharmaceutical companies, that if you're trying to get the pharmaceutical company engaged in public work, sometimes what you need to do is to really dive into the idea that their employees and their public persona will improve because they do this very small thing to them. Economically, it's a very small contribution for them. But in terms of life improvement, it's massive for thousands and thousands and thousands of people. And that we can't, as public health people, we can't forget that that really is that's a superpower. Being able to call up that there are motivations towards participating in public health activities that aren't the classic ones that we think of all the time. As a public health person, we think, well, you're not going to go blind in 20 years. Well, maybe that's not what matters. What matters is you're not going to itch.
Exactly.
And I just thought that's just so clever to be able to pull that kind of subtlety out and to remember that it's those subtle lessons that maybe are sometimes the most powerful in the public sphere. But there are so many of the lessons that you went through that I think are really relevant for these moments. I'm gonna get us to pivot just a little bit and to talk about the fact that we really are in a crisis time for so many people who are working in public health. But what about the folks that are just beginning in public health? And we have some in our audience. They have dreams. They have a vision. They have something that they've invested a lot of sweat and certainly a lot of sacrifice into trying to become a public health person. And yet it looks like the careers are lessening in number. It looks like, at least from the outside, it looks like there are going to be fewer opportunities in public health because the funding appears to be going away. What would Dr. Foege say about this reality, and what kind of advice would he give to people that are looking at a potentially smaller world than the world that they thought they were walking into?
If I channel what I know and have learned over the years of Bill Foege, I think, first of all, he would take a historical perspective in this moment, because he always did. He would always, look back. Public health, we have to remember, historically, public health has never had unlimited resources. There have always been moments of constraint. In fact, I think he would also point to history where some of our greatest achievements have actually occurred during some of the greatest periods of scarcity. And so that's an interesting tension point, I think, for those that when we're living in it. If you look at smallpox, they certainly didn't have unlimited funding, but it was a story of incredible innovation. It was an extraordinary innovation, and I think that's what he would lean into. He would tell us that resources do matter, and he's a realist, and he wouldn't sugarcoat anything, because we are, in moments of challenge right now. But I think he would say that imagination matters more, and that we need to really tap our creativity. So he would say, don't confuse budgets with purpose. So stay focused on purpose for sure. The communities still need public health. We need healthier pregnancies. We need safer food. The threats come every day. So there's that tension is also there. The constraints force innovation would be number two, and that's where young folks coming in. I mean, this may be your moment to bring forth your talents in ways that you maybe hadn't imagined that you would need to do. But this is when we form our best partnerships. This is sometimes the greatest use of technology. This is sometimes the strongest collaboration. So it's a matter of thinking differently, and that it can be hard, but it also can be exciting. And then investing in relationships. Partnerships become really more valuable. So that's business relationships. What businesses are hiring public health? All right, philanthropy. How's philanthropy changing and shifting? We can think through some of those things. So I think Bill would say, he wouldn't necessarily ask whether this is the hardest time. I think he might ask whether we're preparing the next generation to be even more creative than our generation. And that's on us to help the younger generation to think more creatively and maybe push our partners for some of the jobs that maybe have been lost elsewhere. There's a lot of new things happening out there, with collaborations that wouldn't have happened without this moment.
Right, right. I wonder, are you able to tell us a story about how the scarcity of vaccine really forced the development of an innovation, the ring theory? Are you able to tell us about that? Scarcity
About
of
how the
smallpox, scarcity of smallpox
Yeah, I mean, well,
vaccination
that was
in
part
Africa.
of it, right? I mean, again, it's unlimited. You don't have unlimited resources whatsoever. So that was part of the pinch point with the eradication of smallpox, is that there just wasn't enough to go around. And that's where Bill Foege's brilliance came in with the ring, this idea of a ring vaccination, that he, and that's talk about innovation. He's taking what he learned with forest fires and how to stop a forest fire more effectively, by doing actually the opposite of what you might think, burning out. So this was pushing that thinking where you needed less vaccine if you only vaccinated those that you did then, and this meant you had to have the talent and the boots on the ground to be able to do the contact tracing, find out who had come in contact with those individuals with smallpox. Then you had to convince them to get a vaccine, right? For that ring vaccination to work took a lot of boots on the ground and a lot of partnerships. And Dr. Foege will tell you that. I mean, he believes in public-private partnerships because he'll tell you that nothing large and bold like eradicating smallpox could ever have been done without multiple partnerships, and that included private sector, for sure.
Yeah,
Fascinating.
right. So somebody has just written in lessons from my career. Don't be afraid to lead, to be the one out there who's saying what's true and what's needed and what's the best approach. No need for dogma, certainly, but need not to be afraid to stand out and stand up. Yeah, I like that. Thank you very much for that. When you were talking earlier uh, about thinking about what kind of jobs are out there, it just sort of reminded me. I moved to Richmond, California recently, and uh, as I was researching Richmond and its history, and it has some really, really interesting programs, including what I think is major innovation in the area of community violence prevention. A number of years ago, Richmond elected a public health nurse as its mayor,
Oh, wow.
Irma Anderson.
Huh.
And the fascinating thing about her story, and if you look her up in Wikipedia, she says this right in there, but it's a really nice story about how she came from Contra Costa County, where she was a senior public health nurse, and she looked around and she said, these problems are public health problems, and we need to take a public health approach.
I love it. I
And
love it.
the Office of Community Services was developed. And I just thought, that's just so brilliant because it
Yeah.
really is true. And it means, for people starting in public health or who are interested in public health, maybe don't have a public health degree, think a little bit about where the opportunities are in local government and local community organizations, where the ideas, the
Yes.
really
Yes.
fundamental principles around everyone needing a place to be healthy, how that really could be your role. And maybe it's not a public health job that you thought of when you first started, but again, keeping Dr. Foege in mind and having the life plan as, having the life philosophy as opposed to the rigid life plan.
Right.
Taking the lessons, the wisdom, the absorbing the various experiences that others have had and applying them to the things that are right in front of you might be the most rewarding work, even though it wasn't a public health job.
Exactly.
Exactly. And it could turn
Well
around
said.
an entire community. And I just think
Yes.
about, Mrs. Anderson and the work that she did here. And I still, to this day, I just marvel at how brilliant that was. Transformed a police department, transformed city government.
Mm-hmm.
That's important stuff. Public health perspective. Ooh, just gives me chills to think about it. So let me ask you, when one of the things that he talks about a lot in his writings and in his speeches is he talks about unwarranted optimism. So, how this is a rough time. This is a
Yeah.
time when we're feeling a lot of rub, a lot of pinch, and I want to know how you think we can invoke this sense of unwarranted optimism, but reframed our uninvited season. I mean, that's where we are right now. We did not ask
Yeah.
for
Yeah.
this. How can we frame this as an opportunity?
Yeah, I have to tell you, that's one of my favorites from Dr. Foege, this unwarranted optimism. But you don't want to misunderstand what he's saying here. It's not pretending that everything is fine, because Dr. Foege, like you said, was a realist. It's not ignoring that reality, but it's choosing hope uh, despite incomplete evidence at the time, or this changing season, as you said, it's the uninvited season. One of the things Dr. Foege said is that pessimism is intellectually easy and optimism requires courage. Think about that for a minute. That I love that. That's kind of adds on to that this unwarranted optimism. So I think there are four things that Dr. Foege would tell us, and I'd reframe it around. One is going back to his always remember history. But during this moment, we already talked about that. Every generation believes that public health has been at the breaking point. Every generation feels like, yeah, and yet somehow every generation leaves public health stronger than they found it, and that's our charge right now. Second is, and I love this, see disruption as design space. So we've got a lot of disruption, but how do we lean in and use this space and time to design? The systems are changing. Again, it comes back to the new partnerships that might emerge, the technologies, some of those things, and new leaders are going to emerge, and they are. I'm watching it firsthand, watching new leaders. Who's this person? And wow, what did they just do? So periods of disruption create opportunities, and that's what is it? May you live. It's the Chinese curse. May you live in an interesting time, right? Yeah, or the crisis is opportunity kind of thing. The third thing is, I do think this is a time we need to invest in our young people. I really feel strongly in that. It's one of our greatest reasons for optimism. And Dr. Foege always, I will tell you, I was at the Carter Center one night when he gave a talk, and it was all young students. He ended, and he was a very, very tall man. They all wanted to take his picture, and of course, this tall man, he had students just surrounding him because they couldn't get enough of his wisdom and enough of his unwarranted optimism. They really took hope and inspiration from that. And so I think that's uh, I think our young people can have imagination that we never could have tapped into. Um, and then the other is that we do in this moment of time, and I think for Dr. Foege, the unwarranted optimism is success in public health is defined over decades. It's not election cycles. Election cycles come and go. And if you look, I will tell you, if you look at the long arc of history, and I had a really good friend who's in engineering, who's a big history buff. He told me not long ago, he said, that all of this will pass. I mean, there will be forces that will change the arc of history, and this was a predictable period of time if you look at the long arc, which is, I wished I'd studied history better. I wished I'd been a better history student, I have to tell you. So I don't think Dr. Foege would tell us everything is going to work out. He's going to say history gives us permission to believe that determined people working together can accomplish far more than today's headlines are suggesting.
It's interesting that you say you wish you'd study a little more history. What I find myself doing over and over again, I've just gotten obsessed with listening to podcasts about history. And it's not just American history, although American history is really fascinating. And there were some terrible things that happened with some very creative and very persistent people out there who insisted that the values that we needed to hold dear were important enough to go fighting, go out and fight for, and go down fighting for.
Yeah.
And that has given me a great deal of hope in a time where a lot of people I know really feel kind of hopeless.
Yeah.
But studying history has been really important, and not just American history, but going back and looking at a lot of other
Mhm.
histories, because people have moved themselves out of incredible desolation into
Yep.
great accomplishments. And
Yeah.
it's important to keep hearing again over and over again.
Absolutely.
Their ingenuity and their ability to foresee a future at a time when it looks like there is no future ahead of you
Yep.
is really a quality that right now we need more than ever.
Yeah.
And so I love that you're saying that
Hey,
about
speaking of
his
history,
perspective. Yes.
today marks the 80th anniversary of the CDC.
Whoa.
Yeah,
Happy
it
birthday,
was 80 years
CDC.
ago today. And then, of course, we're coming up on the 250th birthday anniversary of our country. And I don't know if folks realize, but our first president, George Washington, as a teenager, survived smallpox. And then he, in turn, made sure everybody got vaccinated, as well as I think Thomas Jefferson. So we've got a long arc of public health, 250 years of public health here in the United States, right?
Yeah, yeah.
A lot of historical notes.
I was actually just listening to his comments about the award that we were in with Canada, where the reason Canada had such an edge on the Americans was because they had vaccinated their people for smallpox,
Huh.
and the American soldiers had not,
Yep.
and went in and got sick. And so the
Yep.
American soldiers were being carried sick off the field, and Canada could declare victory and thus remain independent.
Yep.
Interesting, interesting.
Yeah. Yeah. Well, and CDC, the roots of CDC were malaria and the troops. So yeah, history has a lot of lessons.
Right, right, right. And he also said something over and over again that I thought was really important about compassionate, consequential compassion. And that as you're forming your life, your career, that compassion is one thing and it's all well and good. But what really matters is being consequential with your compassion.
It's
And I
beautiful.
wonder if you recall any stories about him talking about
Yeah, I mean, he certainly
consequential
talked
compassion.
about he did. I don't know. I'd have to pull up. I don't know if I have a specific one where he was specifically talking about that, but he did reference that.
So maybe you could run through the 9 lessons from smallpox.
Yeah, so this is something folks do need to know. It's called Nine Lessons to Change the World is the name of the and it's being housed at the Task Force for Global Health. So there's a whole curriculum around this that folks should know about, that you can go online. Schools of public health can use it. Anyone. I mean, these 9 lessons to change the world. It's also been called Becoming Better Ancestors because he called upon us to think about ourselves, he always talked about thinking of future generations, right? And what he would imagine, one of the stories he told, maybe this does have to do with consequential, empathy and so forth, is that he would envision children several generations, 300 years from now, and he was their proxy, right? The decisions and things we do now impact future generations. It was beautiful. I mean, Dr. Foege, he was so poetic in so much of what he said. But these are the 9 lessons. I'll go through them quickly, but and some of them you kind of heard in those 10 because there's some things that overlap. He talks about it being a cause and effect world. So number one, you've got to understand that we are in a cause and effect world, and things happen for a reason. So public health begins by asking why, is the way we need to think about that, not accepting disease and injury or inequity is inevitable. So there's a lot of relevance to that. The second is to know, share, and act on the truth. And he was, very, very staunch on that. But again, science matters, but knowledge alone isn't enough. We have to communicate evidence honestly and use it to improve lives. The third is about coalitions, how essential coalitions are. We've talked about that. His fourth is avoid certainty, which I did talk about that. We can't, that's where some of this overlap comes. Um, Five is to build in evaluation and continuous improvement. And if I've learned anything through my career, you always build your evaluation on the front end. How are you going to evaluate? That should be in every early meeting, thinking about that, and then continuously improve. His sixth is respect the culture. and that culture matters, and that we all our communities, they they have the lived experience. This really speaks to communities being involved in decision making and design of programs. And if you really want it to be successful, it's got to fit the values and the realities of the community. Um, 7 is seek strong leadership and management. He at CDC, he always talked about the public health advisors really being the strong managers and the leaders being like the EIS officers or the scientists. And the pairing of those is really essential. You need leadership and management. Vision alone is not enough, right? Somebody has to implement. Execution really matters. Number 8 is mobilize political will. Now, we haven't talked as much about that, but mobilizing that political will, because evidence rarely changes policy by itself. And I think we've certainly see that play out in today's world. But people do, and public health must engage leaders, communities, and decision makers. When I was state health officer in Indiana, I mean, that was a huge lesson for me for how to go about creating the political will. And then his 9th is to move toward global health equity, that he feels the ultimate purpose of public health is fairness. Health should not depend on where someone's born, how much they earn, or who they are. And so obviously this is quite relevant when we think about maternal mortality, we think about pandemics, climate, chronic disease, I mean, you name it. So those are his lessons about smallpox. And what I just love about Bill Foege was his endless curiosity, his humility, his humor. There were just so many qualities that he had that you knew, like I said early on, you knew you were in the presence of a giant, when a real giant of a human being when you were in his presence.
When you mentioned mobilizing political will, this certainly is a time where we need to all become extremely skillful at doing that. And it reminds me of a story that he told about being in Africa and trying to move through an area that was being invaded by various warlords. And they had a lot of vaccination they were trying to get from point A to point B. And they were being impeded by the war that was going on. And that what he did was to talk about to get to the top of the heap and to talk to the guy in charge and to say, right, look, we just stole these vaccinations from the government and we want to move them out. And that was the alliance that he formed. That was the way in which he mobilized political will in order to get his work done. Very very clever, very unexpected, and certainly a way of mobilizing political will.
Yes.
I don't know how you teach that. I don't know how you teach mobilizing political will in public health, but I think that this is really something where we need to look at those people who mobilize others well, who organize others well, who've done the community organizing work and know how to incite the fury and the passion and the real desire to see something done.
Yes.
To figure out how we ride with that.
Yeah. Well, and you're hitting on, I've really given a lot of thought to this recently, in the recent times in public health. I think when we talk about coalitions and we talk about skill sets and you talk about thinking broadly, we need the advocates, absolutely. And the comment that came in earlier that you read, right? You need folks to speak out and take on the causes. But as part of that ecosystem, you need the diplomats. You need those that are the whisperers. You need those that are actually talking to all sides and not, so it's a really intricate puzzle that needs to be put together. And when I think about like passing tobacco legislation, like we raised the cigarette tax in Indiana and then smoke-free air law, some of those, then, there was a lot of pushback from tobacco industry and, a lot of forces against you. And when I think back, we did do that combination of having the advocates and the children and, the visible, but then we had the whisperers and you had the ones that were the diplomats and the ones that were behind the scenes kind of talking to everybody and in ways there's a lot that goes into moving good policy.
Right.
And teaching that is, I think people need to be involved. I think they need to, whether it's state, local level, whatever, I think that involvement helps teach, learn by doing.
Yeah. Yeah. Oh, one of the other things that I reflected on as I was listening to him this morning was the fact that he was addressing some medical students and saying, everything that you think you're learning here are not going to be the things that's really the most valuable to you. In fact, most of the things I learned in this place, in this medical school, aren't very useful to me right now. But what I learned was a method. I learned a method of thinking. I learned a method of asking questions. And I wonder if you'd like to comment at all on how that interfaces with the world that we're looking at, where AI is starting to become a dominant theme of conversation, and
Yeah.
how that relates.
I couldn't agree more. I mean, all of us, yeah. I mean, I certainly didn't learn anything about AI in school. Did you? I mean, none of my degrees or classes, I mean, it didn't even exist, right? However, I think we did learn to discern and to ask, learning to ask the right questions, when you're in school, learning some of those basic principles are so important, regardless of then what comes down the pike, like AI. I think we've all become students and will continue to learn as AI. What's the good, the bad, and the ugly? And then how do we influence how it's used? One of the things that we're uh, involved with here at the foundation and talking with a lot of partners on is how might an AI agent help community health workers, and how do we involve the community health workers in the development of an AI agent and not just have the companies designing, because those are happening, right? This technology is going to take off with or without us. So how do you get to the table? How do we help influence how that looks and how that design truly takes place? Those are lessons that you learn when you're if you're studying public health, you're going to learn skills that can be applied to those new frontiers that we're facing.
Yeah, and it reminds me, I just want to remind the audience here, if you didn't get to hear it, there was a webinar that we did a couple of weeks ago on AI in public health. And the lesson I take from that is really one that I kept hearing Dr. Foege underscoring in various ways in the speeches I was listening to. Learn to ask a better question. Learn to ask really good questions. And that's the lesson about AI. How can you ask the best question? How do you test out your best question? Because it really is in being able to ask the best questions that you'll
Yes.
get to a path that you need to start following and uncovering where you need to go. We only have a little tiny bit of time left, but I wanted to ask you, uh, you had a really meaningful career in public health, a really wonderful career. And I wonder, given that we're in these times right now, this uninvited season, what gives you hope?
Yeah, you know what I've taken a lot of hope and a lot of inspiration from are the grassroots leaders that I'm seeing emerge, the local leaders. I believe in communities. I've told folks I'm putting my money on state and local. I think there's just such rich opportunity, and so I just know a lot of amazing leaders across the country at that local level. I'm taking heart and inspiration in, I mentioned already, but the new partnerships that are being forged and where there's a receptivity. And I think we do need to push our innovation, that we got to push ourselves to be more creative. And so that part, I do think that we've got, you mentioned AI, but we're sitting on this an amazing opportunity of innovation with our data and data surveillance and freeing people's time from the to be able to actually think and to apply, I think is something that gives me hope. But my greatest hope will always come from youth. Will always come from our students and our young, and the next generation. Have to be inspired by the next generation.
Well, that's really a wonderful place to wrap this up. I want to thank you. I think this has been just such a thoughtful conversation, and I hope that everybody will use the opportunity to just get into YouTube and start looking um, at the speeches he gave, because
Yeah.
they're full of the best
Yes.
stories, and they're very uplifting, and we need to
Yes.
be uplifted, and we need to be fortified. We need to be vaccinated with hope, and we need to be vaccinated with imagination and
Yes.
innovation. This is the time for that.
I love that.
So if we could just call up the last slide, please. And just to let everybody know, we really want to make sure that you know that Dialogue for Health is a tool for you, and please come to us with your ideas of what you would like to see more. I think there is so much opportunity for us to innovate with your ideas. So please help us to bring the folks that you want to see up on the screen. We love having these conversations, and we thank you for being with us. Goodbye, everybody. See you next time.